Good afternoon. Thank you all for joining us on the Social Security Benefits explanation webinar. Amber is here to talk to us today. Amber, you can unmute if you can, please, and we will get started on the webinar. Hi.
Hey.
So, thanks, Amber. So Amber's here to talk to us about Social Security benefits and kind of unravel some of the things that we're all curious about. I have a 17 going on 18-year-old that I'm going to be going through the process with here shortly. And so I would like us all to benefit from that information. Again, I am Katie Durkee. I am here with NAMI Piedmont Tri-County. We are based in Lancaster, Chester, and York counties. We have a drop-in center here in Rock Hill, but we are the largest grassroots advocacy for mental health awareness, advocacy, and education. We also run support groups, and everything that we do is free to our community. So if you're in York, Lancaster, or Chester, you can go to our website at namipiedmont.org to find out all the things that we have going on. We have some finance classes coming up. We have some art classes coming up, pet therapy, yoga, all kinds of things going on. So check out our website. And so thanks so much for joining us, Amber. I am going to, is the audio choppy? I apologize. Hopefully Amber's will be better. So if you have any questions during the webinar, please, you can either put them in the chat or in the questions and answers, and we will go ahead and get those at the end. But in the meantime, I'm going to let Amber get started, and we're looking forward to it. Thanks, Amber.
Absolutely. And I'm wondering if maybe it was choppy because I was unmuted at the same time, and sometimes that happens. So good afternoon, everyone. My name is Amber Lydford. I am a benefit specialist for South Carolina Vocational Rehabilitation. I have been with Voc Rehab. I'm actually finishing up my 8th year, entering my 9th as of May. So I am very honored that I've been asked to do this presentation, and hoping that I can maybe answer any questions through these PowerPoint slides. Again, as Katie had asked, if anybody does have any questions, please drop it in the chat, and I'll be happy to answer anything that you guys have. So Social Security benefits, this bridge, of course, shows SSI on one side, SSDI on the other side. There are two different disability programs, one again called SSDI. If you follow down the left-hand side with me, Social Security Disability does go by many different names and acronyms: Retirement, Survivors, Disability, Title II, DIB, which is Disability Insurance Benefits, SSA, SSI, SSD, SSDI, Government Check. On the right-hand side, SSI is actually called Supplemental Security Income. It also goes by many names and acronyms: Disability, SSD, SSI, SSA, Government Benefits, or First Check. And the reason why it says First Check is because the SSI benefits do come on the first day of the month. So under SSDI, the wage earner must have accrued sufficient credits of coverage to become eligible for a benefit check. In 2022, for every $1,510 in gross wages, the individual will earn 1 credit for a maximum of only 4 credits a year. So if you earn like $8,000, you might earn more than 4 credits, but you cannot earn more than 4 credits. You can only earn a maximum of 4 credits a year. It might appear that way if you earn like $8,000 for the year, but again, only $1,510 in gross wages will equal 1 credit. They go by quarters. So in the first quarter, second quarter, third quarter, fourth quarter, you need 40 credits, 20 of which were earned in the last 10 years, ending with the year you became disabled. Under SSI, the individual does not need to have a work history. Eligibility is based on if you are disabled, you or your spouse's or parents' income and resources. Parents' income, again, is if you're under 18. How much can I expect to receive under these benefit programs? Under SSDI, how much a person gets depends on their work history and other factors, like if they're getting workers' compensation, state or federal disability payments. Under SSI, the highest amount a person can receive in 2022 is $841 a month. SSI looks at factors like living situation, unearned and earned income, and other support the person may get, like assistance with paying bills. Under SSDI, what about resources? There is no resource limit to be eligible for SSDI payments. For example, if Bill Gates became disabled under the current Social Security rules, he could become eligible for disability benefits regardless of his resources. Under SSI, the resources must be below $2,000 a month for a single individual and $3,000 a month for a married couple. Sorry, Bill, no SSI for you. your resources are too high. Under SSDI, what about retroactive disability decision? I get this question a lot, such as I applied many years ago and I only got approved for the last 12 months. Well, the reason why is because the provision for payment up to 12 months before the date of application. So if I applied in 2022, but my disability occurred in 2018, Social Security is only going to likely give me benefits going back to 2021. So if the wage earner, and this is a great example, if the wage earner applied for benefits in January 2015, but actually became disabled in March of 2014, it's possible that they'll go back to March 2014 when deciding when the person became disabled. For SSI, only decided from the date of application. So if I'm eligible for SSI and I applied in 2022, January 2022, but my disability actually occurred in 2021, there is not a guarantee that Social Security is going to go back for SSI. So there is no retroactive decision allowed. If you became disabled on March of 2014, but did not file until January 2015, then SSI will use January 2015 as the date. Under SSDI, like the retroactive decision, payments can be made up to 12 months before the date of application, minus the 5-month waiting period. So again, I've had individuals tell me I got a back pay, and that when we're really trying to look at when did the date of disability occur, date of disability onset, date of disability entitlement, and so they can go back. Minus the 5 months waiting period, there is a 5-month waiting period. So I think we get into that a little bit later, but example is if I applied for Social Security today, January 2022, my disability occurred in December 2021, then I could be eligible as long as there's no hassle for application approval, then I could be eligible for benefits in June of 2022. It's the 5-month waiting period. For SSI, like the retroactive decision process, payments cannot be made before the application date, despite if the disability onset date occurred before the application process. So when do I get my first check? From the under SSDI, from the date one becomes disabled, there is a 5-month waiting period prior to starting the benefit payments. As I just previously explained, if a person became disabled on January 2013, then the first check is in July of 2013, 6 months later. I apologize, I said 5. An individual may receive benefits as of the first day of the month following the month of application for SSI. For example, if you file on January 1st or January 30th, it does not matter. Your first check could be February 1st. Protected filing date. This is big. When you apply for Social Security, make sure that you are telling them that you want that date that you called for the appointment. You want that as your protected application date. The reason, Social Security will need to go back, or they should go back to that date. So again, if I called on today, January 25th, 2022, and I scheduled an appointment to apply for Social Security, I would tell the representative, I want today as my protected filing date. So when are payments? Payments for when? For SSDI, the checks are paid 1 month behind. For example, the check that you receive in May is actually for April. And remember the 5-month waiting period example, if a person became disabled in January, their first check's not until July, because July payment is for June. For SSI, the checks are paid for the month in which they are received, but based on circumstances 2 months ago. For SSDI, when can I expect my check? Generally paid on the 3rd of the month if applied before May of 1997. If an individual applied for Social Security after May of 1997, then the check arrives either the 2nd, 3rd, or 4th Wednesday of the month based on your dates of birth. For SSI, the checks are paid on or before the 1st of each month. If the 1st falls on a weekend day or a holiday, then the check will arrive the day before. For example, January 1st is a holiday. It was on a Saturday. You're going to get your check December 31st, that Friday. And January 1st is a holiday anyway, so you're always going to likely get it the day before. For family members, I get this question a lot as well, especially under the SSI. So I'll look at the SSI side first. An individual is receiving SSI, no family member, child, even if they're a brand new baby boy or girl from the hospital, is going to receive a benefit off of you because you are getting SSI. No family member of the SSI recipient will be eligible for SSI benefits unless they independently establish eligibility for SSI on their own. For SSDI, it benefits to the worker's family. For example, spouses at least age 62, or caring for a child under 16, or caring for a child with a disability regardless of the age of the wage earner. For example, if I was receiving disability benefits, I currently have a 10-year-old child. If I was receiving disability benefits, my 10-year-old could be receiving benefits off of the wage earner, which is myself. If I was married and my spouse was at the age of 62 and I was currently receiving benefits, my spouse could possibly receive benefits off of myself at the age of 62, even if he doesn't have a disability, as long as his own benefits aren't higher than what he's eligible for off of mine. Divorced spouses, you have to be married at least 10 years and the person is 62 years old or older and unmarried. For children, if under the age of 18 or 19, if a full-time student in high school, and dependent unmarried child of an insured eligible worker, regardless of disability, will receive benefits from the wage earner, the parent, as previously explained in the previous example. Under SSDI, also the adult child with a disability age 18 or older of a retired, disabled, or deceased worker if the disability was before the age of 22. Again, under SSI, no family member of the SSI recipient would be eligible for SSI benefits unless they independently establish eligibility for their own, for SSI on their own. So what about medical insurance? Under SSDI, the individual is eligible for Medicare 24 months after the date of the first check. For example, if I received my first disability cash payment in January 2022, my date of eligibility for Medicare would begin in January 2024. Part A is the hospitalization, Part B is for doctors, Part D is for prescription drug assistance. The individual under SSDI may also be eligible for Medicaid as well. Under SSI, in most states, a person is eligible for Medicaid immediately if receiving at least $1 in SSI cash benefits, including South Carolina. So I get this question, well, what happens if I go to work? Well, under SSDI, the cash benefits are not affected until gross monthly earnings go above the substantial gainful activity level. In the year of 2022, an individual receiving SSDI can actually make up to $1,350 a month in gross wages and maintain their full cash benefits. With SSDI, I like to look at it as an all or nothing benefit. Either you're entitled to all of it or you're entitled to none of it. If your earnings go above $1,350, you're likely going to lose your cash benefits. We'll talk about medical soon. Most importantly, you've got to report, keep a paper trail, make sure that you document whenever you contact Social Security, who you talk to, the date of reporting. I always recommend faxing the documentation into Social Security or certified mail. We'll get to that a little bit later. Under SSI, the cash benefits are affected once the gross earnings go above $65 a month. There is no SGA rule with SSI. So for SSI, I like to call it a teeter-totter benefit. Unless you're making the same amount every single month, your SSI check is going to fluctuate. For example, if Sally earned $865 in January of 2022, you report between the 1st and the 10th of February. So she earned $865, SSA's 2 for $1 event. $865, they don't count the first $65 that Sally just made. Now we're looking at $800. The 2 for $1, they're counting that and cutting that in half. Now they're only looking at $400 of Sally's of wages. Let's say Sally's getting the $841 in the year of 2022. You take away the $400 from the $841, Sally's SSI check in March will be $441. Now, I always tell everybody, don't panic, because when you take that $441 and add that to the $865, you have over $1,200 of total income. So you're always going to have more money by working, even under the SSI cash benefit category. And again, report between the 1st and the 10th of the month, document, fax, and also get connected with any of myself. I'm a benefit specialist here at Vocational Rehabilitation. You can always get connected with Voc Rehab. There are certified benefit specialists on staff or any WIPA program in your area. Under the Disability Adult Children Pass Along program, we get this question regarding Medicaid. We have some individuals who their parents are aging out, they're getting ready to retire, and the adult child has been getting SSI and has a disability before the age of 22 and is now getting ready to draw a benefit off of the parent. So the Disability Adult Children Pass Along Program is a Medicaid program that may allow individuals who are on SSI to keep their Medicaid when they become eligible for benefits off the parent's record. But they must meet all 4 of the following criteria to be eligible. They have to have lost the entitlement to SSI because they either became entitled to or became eligible for an increase in Title II benefits off of a parent's record, and the SSI beneficiary must be over the age of 18, and the SSI beneficiary must have become disabled before they have reached the age of 22. And finally, they would be eligible for an SSI benefit if the amount of the entitlement or increase in the Title II benefit received on or after July 1st of 1987 were to be disregarded. Again, if the individual was disabled is over the age of 18, has a disability, and the disability occurred before the age of 22, they now became eligible for a benefit off the parent's record because parent is now disabled, deceased, or retired. They could be eligible to keep the Medicaid under this pass along program. Also indicating that if the individual was not entitled to the benefit off the parent, they would be entitled otherwise to SSI. If the individual becomes entitled to benefits off their own work record, pass along program does not count. If the benefits off their own work record being them above the income limit. When dealing with SSA, Social Security Administration, that's what that stands for, by the way, or any other type of organization, always document the date, the time, and who you are speaking with, and summarize the conversation or interaction. Always ask for copies. Anything they ask you to fill out or anything you provide them, document the date and the person you gave it to. I know, again, due to COVID, a lot of offices are still closed in person. So I always, again, recommend faxing where you're going to get a confirmation sheet back, contacting your local Social Security office if you're working with Social Security, and ask who do you send the documentation into, attention it to that person. And again, always make sure that you're getting a confirmation sheet or something back, verifying and validating that it was actually successfully received. Again, I just said that faxing, print out the fax confirmation sheet. If you're mailing anything, always ask for certified mail. On your copy, write date mailed out, where is it going, and who is and who the envelope you mailed it out to. Or there's this copy of what it looks like for the certified mailing. I wanted to talk a little bit about TEFRA Medicaid. I know that there are sometimes some parents who are working, their income limit is too high, their income is too high and above the income limit for their child to receive SSI cash benefits. In my years of doing this job, I have noticed that there are a lot of parents that are unfamiliar or unaware of TEFRA Medicaid. TEFRA Medicaid is a Medicaid category available to children under the age of 19 who meet disability criteria, but the parental income is too high for an SSI cash benefit. The income under this category is based off the child's income and not the parents. The resource limit is still $2,000. The disability criteria for children is different for adults. Social Security has an adult Blue Book listings, which can be found at this link listed below. I also work with individuals who are going through an age 18 redetermination. If the child is getting TEFRA Medicaid, contact your local Social Security office and schedule an appointment to apply for benefits the month before the child turns 18. The reason why is because TEFRA Medicaid, again, is eligible to children under the age of 19. And I have met with a lot of parents, the child is turning 20, Medicaid is all of a sudden stopped. And now they have to go through the application process, which can be a little lengthy. It can take up to, I believe, 45 days to 6 months. I know Social Security's lack of staff right now, so applications are not getting processed timely. As a result, if somebody is under the specific example where the Medicaid stops because they were under TEFRA and they've aged out, now they're going a period of time without any medical insurance. So if the individual is under the age of 19, currently receiving TEFRA Medicaid, always before the age of 18, I know I just said 19, but before the age of 18, call and schedule an appointment to apply for benefits even in the month in which the individual turns 18. That way, you had that 1 year grace period where you know TEFRA is good until the age of 19. You have from the age of 18 to 19 to go through the application process for SSI to see if they're eligible for benefits as an adult. Getting an age 18 redetermination is common procedure if the individual is under the age of 18 and currently receiving SSI. Social Security is evaluating whether or not the child, now the young adult at the age of 18, meets the adult disability criteria. There are two different documents you can actually print off and complete in pencil prior to calling for an appointment or when an age 18 redetermination is happening. They are the Disability Adult Report and the Adult Disability Function Report. Again, two links that are there and available. They are public knowledge. I always recommend filling these out, being very detailed and giving as much descriptive information as you possibly can to show how your child or you yourself are eligible for benefits as an adult based on the disability criteria. My supervisor's name is Tom Main, and he can be reached at 803-896-6986 or tmain@sddrd.net. Again, my name is Amber Lydford, and I can be reached at 803-609-9819 or alydford@sddrd.net with any questions. If you think of anything later on, don't hesitate to email us. We are generally available, of course, Monday through Friday. I do cover a couple of territories here in South Carolina, not necessarily the upstate, but I do cover the Midlands. We can always get you in touch with the benefit specialist through Vocational Rehabilitation, who does cover the upstate. That way, if you want an in-person appointment, we'd be more than happy to sit down with you and talk to you about in-depth, more detail, working while receiving benefits, the application process, the appeals process, anything related to even as if you have a 17-year-old child and what's going on. But at this time, that is all I have to share. Does anybody have any questions?
Thank you, Amber. That is so much information and so fast that it's a lot. Leave those numbers up for me because I want people to be able to screenshot those or get those. And I want everybody to know that this will be on our YouTube channel. It will also stay on Facebook. So if we need to go back through this, we can go back through this and look at those different determinations. I definitely have some questions for you, Amber. And as I said, I have a 17, almost 18-year-old going through this process right now. So I'm going to use myself as an example. If anybody wants to jump in with questions specific to their own situation, you can post that on the Q&A or you can put it in the chat and I will make sure that we talk to Amber about those. But so tell me, first of all, what happens if we have just a situation where they're moving from, I need to get my battery charger, sorry. If they're moving from that TEFRA Medicaid through to our Social Security, what's the criteria for that? We maintain the same criteria. How do I know what I'm looking for? Am I looking for SSI? Am I looking for SSDI? Does somebody else determine that for me? How does that work?
And that's a great question. So when receiving TEFRA Medicaid, Social Security is not going to know to send you an application to apply your child for SSI. So that is where you are then with myself, this information. It's okay, well, I know I remember this presentation. I believe my child meets the adult disability criteria per the link that I put there as well. Go through the adult blue book listings. There's categories. The individual can actually click on a category, go through how does Social Security deem an individual eligible? What's their criteria for autism? What's their criteria for depression? What's their criteria for anxiety? What's their criteria for spina bifida? They actually have all of these different criteria listed on that adult blue book listings and how do you meet the expectations of that disability? So your child's aging out of TEFRA, Social Security, again, they're not going to know to send you an application. That's where you come in, you contact Social Security, again, the month before the child turns 18 or the month in which they turn 18 and ask to schedule an appointment. You contact your local Social Security office. Please do not call the 1-800 number. You will be on hold for ages. And then they may not even get you connected with your local office. If you always get connected with your local office, you're going to likely get through a lot quicker. Just call, ask for an appointment to schedule for to apply your child, your now soon to be adult child, for Social Security benefits for SSI. I will also tell you that it is common that they will apply the individual both for SSI and SSDI. It is likely that the individual, you're going to get a letter saying that they've been denied due to not enough work credits. Don't let that panic you. I've had these calls where I got denied, I need to appeal. And I say, well, read me the letter. And it's, well, I didn't have enough work credits. That's common. It means your SSI application is still pending. So I oftentimes also tell my clients that if they hadn't heard anything from Social Security within 60 days, give them at least 60 days to review the application. From the time that you've turned everything in, the documents that I've provided on here, the links for the adult disability report and the adult disability function report, if you've known that you've turned everything in, signed all the consent forms, and you hadn't heard anything within 60 days, give them a call, check on the status of your application. Trust me, I think that they'd be okay with it. And the more that they hear from you, they may move your process a little bit faster. Can't guarantee it. But yes, TEFRA, you're going to need to call.
What happens if I miss that window? So, you know, been on TEFRA Medicaid, moving into the SSI world. What happens if I miss even that 19-year-old, you know, it goes until 19. What if I suddenly realize at 19 they've cut off Medicaid, TEFRA, and then how do I deal with that? Do I just start the process, and will they bridge that gap for me, or do I lose benefits during that time, or what happens there?
It's a good possibility the medical benefits are going to stop, and no guarantee you're going to be able to get the Medicaid reinstated unless deemed eligible for SSI benefits. That's why I press and push upon the application for SSI right before they turn 18, so that way you're not missing that window. Because after the age of 19, if the individual's receiving all these different therapies and, you know, or medications, and we know medications are not cheap, and, you know, now all of a sudden it's like, well, how am I going to, you know, afford my medications? And now we're looking at different prescription assistant programs while going through the application process for SSI.
Right. I only say that because you tend, when you're on these TEFRA Medicaid programs, with everything else going on, with all the therapies that you have and all the medications and all the explanation of benefits from your insurance company, and from there's so much paperwork coming in that a lot of this stuff, you kind of just, there's reams of paper that you have to read. And if you miss that, then you obviously miss deadlines that you know are crucial. So thanks for that. I have a question. I've got a few more questions from me, but I have some online. It says, if my adult child is receiving SSI and I retire, but begin taking Social Security retirement benefits, does my child have to transition from SSI to SSDI, or do they stay on SSI?
That is a great question. If the adult child's disability occurred before the age of 22, they have to go off the retired benefits, the retired parents benefit. So one thing I also like to discuss is, I get this question, well, does that mean my benefit's going to go down? No, not at all. When you start working, you open up like an account with Social Security. You put in money into like your own, my supervisor likes to call it a vault. You know, you're opening up and you're putting money into this vault. When you work long enough, you put money into a family vault. So should your adult child become eligible for benefits off of you, they're not going to pull from your vault. They're going to pull from the family pot, basically. And because SSI is a needs-based income, it's a federal benefit, you are required to apply for any and all other benefits that you're entitled to. So when you apply, this is the other thing that oftentimes gets missed in the loop. I've had a lot of parents that are reaching retirement age. One of the questions during the application process for retirement is, do you have a dependent child? A lot of times when we're thinking dependent child, we think before the age, like they're under the age of 18. We don't think about disabled adult child. You need to tell Social Security, I have a disabled adult child whose disability occurred before the age of 22. And that way the transition can then start taking place. Those that are transitioning off of SSI to a benefit off of a parent will have to go through an application process, but don't fear, don't stress out, don't panic. That's the word I'm looking for. Because a lot of times like, oh no, another application process. It took me 3 years to get them on SSI. They're just looking to make sure that they still meet the disability criteria. Again, if they met it for SSI, they should meet it for SSDI. SSI and SSDI, it's almost like they work all in the same office, right? They're all under Social Security. But they're like two redheaded stepchildren or stepsisters that they work in the same office, but they don't talk to each other. The two systems don't talk to each other. And that's why you have to do another application under the Title II benefit, which is the retired benefit compared to the SSI. So you have to do a whole brand new application. Yes, to answer that long back into short, you do need to tell Social Security you have a disabled adult child as long as their disability occurred before the age of 22, so they can draw benefits off of you.
That's good to know. What happens if somebody has a physical and a mental disability? Is that dealt with differently, or we just use that blue book and list every single thing that we have going on?
I would list everything you have going on and let Social Security make the determination of what might be the primary diagnosis. On the disability adult report, it does ask about what your challenge is, what are you diagnosed with, and you can list every single one of those and then go from there.
Okay, going back to that last question, how is the payment calculated if I plan to take SS benefits at age 62? Does that make the child's payment less?
It can, yes, absolutely.
So how do they calculate the payment? They just then redo the math, and then the eligibility benefit, it becomes a completely different thing, right? It's maybe like an application is a brand new application. Is that right? So if they're switching from SSI to SSDI, then under the parent, then it's almost like even if they were getting that previous benefit, it becomes almost a new application. Is that
Absolutely
correct?
Absolutely. If I understand correctly, let me just rephrase this question. Wanting to know how the benefits calculated. At the age of 62, if you're taking early retirement, for example, you're not going to get your full benefit amount. I know under Social Security's website, you can go into like calculate my retirement to kind of see how much you may be eligible for. You can create a free My Social Security account. It'll tell you like if I took retirement now, if I became disabled, or if I waited till I was 70, it'll give you an estimation of what you may receive based on your years of work. If you are only receiving $1,800, for example, in retirement benefits, generally we may see where the disabled adult child or maybe the dependent child might be receiving at least half. Generally, they don't receive no more than 50% of what they call the number holder, the parent's benefit. The only time that I've ever seen them receiving more than 50% is if the parent passes away and it's now the survivor's benefit and not a dependent benefit. So it definitely would be no more than half, but I don't know exactly what that calculation looks like. That would be based on the Social Security numbers and however long you worked and however much you put into the family cash pot.
And it's not just then once you get that SSDI or the SSI, then other things come into play. So if you're over a certain age, then and on a fixed income or a lower income, then there's other things like food stamps and those kind of things. Am I right in thinking that?
Absolutely. I mean, food stamps and other public benefit is based on income. A child, like a young adult over the age of 22, even if they're still living at home, may be eligible for food stamps, depending on their own income. Above the age of 22 should no longer go based off the parental or household income if they're technically a roommate in the house. I know, with SSI, we've seen some people getting food stamps. It may be very minimal. We're not exactly sure. I don't do a whole lot with the food stamp calculations, but I do know with Medicaid, again, kind of going back to that previous slide where if the adult child, again, was getting SSI, going back to this question, and now eligible for off of, mom or dad's benefit as a retiree, and that benefit that the adult child became eligible for took them off SSI, they could still keep their Medicaid under the Pass Along program.
Oh, okay. So it doesn't mean once one thing goes away, everything goes away. And it doesn't mean if your income benefits change, it doesn't change your situation where there might be other things that you're eligible for, like rent assistance or food assistance or those kind of things. Am I right in thinking that?
Correct. Yeah. We can always sit down and look to see how much you're getting. Because again, it all comes down to a numbers game, right? I mean, really, we know that the Medicaid is absolutely protected if the adult child becomes eligible for benefits off the parent and were previously receiving SSI. We know the Medicaid is protected. As far as the Section 8 HUD housing, renters assistance, food stamps, we can always sit down and take a look to see, well, how much are the benefits, and just to look, do you still meet the guidelines to still receive that same assistance? Medicaid, okay, we know is protected, but the rest of the assistance, we'd have to really look at the numbers.
And can you help people go through that? Can you help people kind of calculate that, or at least point them in the right direction and help
Absolutely.
them? Okay, that's great. So I do have a couple of questions on my cell as well that have come in via text. So I've heard a lot of people say you're never approved on your first try. Is that true? And is there a way to better your chances of first-time approvals?
That is a great question. I have seen where some people may get denied again on the first time. And generally, the denial can also happen if there's not enough information. That is why I like the fact that those forms they're public knowledge. It gives an idea for the individual to already know, like with that disability function report, being very descriptive. So one of the questions Social Security is going to ask in that function report, number 6 on section C, is describe what you do from the time you wake up to the time you go to bed. You need to be very descriptive. You can't just say, I wake up, I take a shower, I make my breakfast, I sit and watch TV all day. Well, how long does it take for you to get out of bed? How many reminders do you need? Do you need reminders to complete household chores? Do you need help preparing foods? Are you maybe a parent of a young adult with autism who might need reminders for personal hygiene? It's being very descriptive, because what you're really wanting to do is walking Social Security through a day in your life. It's called a day in my life for a reason. You want to be able to give them a complete description where if they close their eyes, they could literally see what your life looks like, from you. So sometimes denials happen because there's not enough evidence. And do appeals have to happen? Absolutely. And it's just providing maybe more information.
Okay, so I'm not there to kind of like, because as a parent, especially as a parent, and I'm filling out these forms, I'm like, oh yeah, totally, we're not that far behind, but knowing in the back of my mind that maybe, there is like those 5 days out of 7 where you have to say, have you like got your shoes and socks on? Have you know what I mean? Mine can put your shoes and socks on, but I mean, just, those kind of things where you kind of just accept those things as fact. You need to put all those in and make sure you spend a lot of time kind of thinking this through and thinking through the steps. So that's always good to know as well, because sometimes, we want to put a nice light on things. We always want everything to be better than it is. But especially for those of us coming out of kind of the school system, where you always start kind of those meetings with what the good things are, how well they're doing, how many good things that they've achieved, and how many goals they've achieved. Coming off of that, I think it's it's kind of second nature to kind of go into this doing that, but you want to really think through exactly the day as it happens. And that's really good advice. That's really good advice for me.
Absolutely. And as a mom myself, I have 3 children with challenges. And that's one of the biggest things. We also go into like these IEP meetings and, well, what are they doing well? When it comes to Social Security, you hit the nail on the head. You don't want to tell them what they're doing well. You want to tell them what they're struggling with.
Right.
Because, we can talk about the progression later on, but why are they, what's causing them to, what's affecting them from being able to work gainful activity. So above the age of 18, they're looking at workability. How does their disability affect their ability to be gainfully employed? Competitive employment. Under the age of 18, they're looking at functional limitations. How does their disability affect their ability to function age appropriately? And so above the age of 18, I've seen a lot of times where denials actually happen under like ADHD or depression or anxiety. They're looking at, is the medical condition treatable? Is it being treated? And, so it's a lot of times it's a catch-22, because if the medication is treating the condition, then, hey, I can function, I can work. But what happens when those benefits go away and the medical benefits stop? Now, how am I going to afford the medication? Now I'm off the medication. Now here comes all my conditions again. Here comes all my symptoms. Now I'm losing my job because I'm not on my medication. It's a revolving door. So, that's why it's so important to be very descriptive, detail.
So yeah, okay, that makes a lot of sense. And that's really good to know, because like I said, I'm coming off of the goals that we've met, not so 18, below 18, when they go TEFRA Medicaid, we're looking at the kids. They don't have to meet criteria. My salary, nothing I've got plays into that. But once they hit 18, then my situation becomes relevant, or no? Explain that to us, please.
Nope. If they're on TEFRA, of course, it's their income, their resources. They've met disability criteria under SSI. They just didn't meet the income limit because parental income. At the age of 18, generally, when applying for SSI, parental incomes should not count. And I use the word should not because every Social Security office is different. They might say, well, they're still in school, or it's the month after they turn 18, maybe not in the month of the 18th birthday, maybe it's the month after they turn 18, right? I have seen it where an individual was still in school and for whatever reason, Social Security was still using the parent's income. So we had to fight through that. But general rule of thumb is once the now young adult turns 18, the parental income should not count. However, child support's a completely different story. Child support is all going to be dependent upon what's in the child support decree, what's in the paper, in the family court papers. If the child is still in school at the age of 18, then it is only 2/3 of the child support is counted against the SSI check. If the child is no longer in school, then Social Security can use the dollar for dollar minus $20. So if Sally's getting $320 of child support, Social Security won't count the first 20, and then every dollar after that, so the $300 will count against the SSI. Now that's the SSI side. Again, SSDI, other unearned income, assets, resources do not count, but it is only on the SSI.
Okay, I just want to go back to when we started and just clarify on this this piece. So SSDI is the Social Security Disability Income? Insurance, okay. And SSI is Social Security
Supplemental Security Income. So the way I look at it, the best way to really break it down, SSDI is an insured program. It means it was paid into by the wage earner, whether it's the earner themselves, such as me or you, or the earner of the wage earner was a parent or a spouse. SSI is Supplemental Security Income. It's basically the welfare program because it's a needs-based income, and any unearned and earned income can affect that cash benefit.
Okay, so just so we're clear on that, because I mean, obviously I'm moving into this new world, and it's like, oh, this is kind of new information because I've been bogged down in the other things that we've been doing.
That's okay.
So the protected application date before the month before they turn 18, is it the day that they turn 18 we use as the protected date, or can we use that month before the 18? You said apply before they're 18.
I recommend always calling to schedule the appointment the month before they turn 18. That one's tricky because if you try to do the protected date before they turn 18, then like parental income might count at that time. So I always say if you're above the age of 18, use the day you call to schedule the appointment as your protected date. But when you're under the age of 18 and you're calling, and the parents calling to schedule their now young adult child for an application for SSI, the application protected date, I would say, would be the date of the appointment. Okay,
that's good to know. And so we know what we're applying for. We're just actually going to apply, and they're going to kind of decide which one is relevant. We might get a letter saying that we're declined for SSDI, but that does not mean the SSI has been declined. Is there ever a situation where under age 18 they can get these benefits?
Off of a parent?
Yes.
Absolutely. The general rule of thumb is if if I had a disability and I was receiving disability benefits and I put enough into that family pot, my child under the age of 18 is automatically entitled to the benefit off of my record. There is no application. When I apply, I'm asked, do I have any dependent children? Do I have any children under the age of 18? Their names, their date of birth, their social security numbers. And so then that way they are then issued the check, I believe, would come like to them, but to me, but on their behalf. I'm not sure exactly what a dependence benefits check would look like, how that all works. I just know that the dependent child is automatically entitled to benefits off of the wage earner under the age of 18. There's no application actually needed for them.
Oh, that's good to know too. That's really good to know. So if a parent gets guardianship or conservatorship of their adult disabled child, does the parent's income then affect that adult child?
No.
Their benefits? Not
the adult. Above the age of 18, the only income that's going to affect the cash benefits of the adult, the disabled adult, is going to be their own income. So if they are receiving any unearned income, again, like child support above the age of 18, because I have had it where it's listed in court papers that until the individual can care for themselves or until death, they're going to continue to receive child support. That's unearned income for the adult child or the young adult at this point. So if a parent receives conservatorship or guardianship of that now young adult, no, the parental income does not count because it's not their income. It's the parent's income.
Yeah, they're just working on helping that person fill out the application. Again, good to know. So we're going to start wrapping up. Is there any more questions or does anybody need any more examples to try and understand the different processes here? I think that if anybody has specific questions or specific scenarios, then I think it's best that they get in touch with you, right, Amber? Because so we're in Lancaster, Chester, and York. Is it you that we call, or is it somebody else in our region that we would call?
I would contact the local vocational rehabilitation department in your areas and just ask to be scheduled with a benefits specialist. There are, Liz, I know as of right now, I know that we are recording and this is going to be viewed even possibly years down the road, but right now Leslie Lugo covers, I believe, York, and yep, I believe she covers York County, and then Loretta Love, I believe right now covers Lancaster and Chesterfield.
Chester or Chester County?
Chester County, yeah. But
yes.
I mean, regardless, I would just reach out to the local vocational rehabilitation department and just ask to be scheduled with the benefits specialist. We can work with anybody who's not with Voc Rehab at the moment. Maybe they're interested in going to work. Maybe they're wanting to know how working affects the cash benefits they're receiving. What's the application process for applying for Social Security? That is what we do. We are nationally certified to deliver that information. And as far as myself, I will tell you that the easiest way to communicate with me is going to be email, probably even for all of us. If you can't get on our calendars right away to schedule an appointment and you're just wanting a quick question answered, generally email is the best form of communication. Okay,
I think that's good to know. I think Voc Rehab tends to be an untapped resource for many, 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 many families. And I don't think we've done a webinar with Voc Rehab, and I was even surprised at how much I didn't know that they offered through Voc Rehab. So there's all kinds of benefits that Voc Rehab can kind of assist with and help with and point you towards. And you guys are really a treasure trove of information. So I think that as well, I would say to people, you know, if it is something to do with rehabilitation or benefits, a quick call to Voc Rehab. They've always answered my questions so quickly and nicely, and nobody ever seems frustrated with my 67 questions. So I've had a lot of success with that. So
well, I'm glad to hear that. And I always say the only stupid question is the one not asked. So I mean, we might get the same question from 10 different people, but it also means that 10 different people are reaching out and wanting to go to work. Maybe they're in my 8 years of doing this, I have very, very few, maybe 3 people altogether total that has said, nope, I'm okay with the benefits. I really don't want to work. And generally it's those on the SSI side because they're so used to just that check coming in. They budgeted everything off that check. They don't like change. Nobody likes change really. But, you know, they're like everyone else that I have worked with because they see the bigger picture. They see they've got support, they've got advocacy, they've got guidance. They're like, hey, I'm ready to go to work. I know I got somebody I can contact and reach out to, especially when it comes to the Social Security stuff, to help them feel a lot better. Because even as a mom who's gone through the TEFRA stuff, even as a mom who's gone through denials, a wife who's gone through denial for her spouse, I know that frustration. I was even that mom that got a letter on a Friday afternoon at 4 p.m., had to reach out to my supervisor, even though we tell people every day, don't panic, contact us. I panicked, I'm human. Saying that my son's Medicaid was going to stop the next week because the mail was delayed. And come to find out, they had the paper at the Medicaid office. They just didn't check box the computer system. So I panicked just like everybody else. But at the end of the day, I know that I had an outlet. And I always say, let me be that outlet for you, or let us as benefit specialists be that outlet to give you relief, to give you that sigh as a parent or an individual who's gone through this process or who is literally wanting, like, I want to go to work. I can't live off of $1,200. I can't live off of $841. I've been told this by the Social Security office. I've been told this by the Social Security office. A lot of times you're even going to get told wrong information by the national number because and that's happened too. I've had somebody getting SSI called the national number, the 1-800 number, that person's not going to look up your case. They're not going to look up your file and say, oh, you're getting SSI. That means if you do go to work, your check's going to change. No, they're probably going to tell you you can make $1,300 a month. So I've had individuals rely on that information, go to work, and now they're looking at an overpayment because they were told, they were misled. So that's why I say don't call the national number if you can avoid it.
Get hold of one of you guys. So that's all really good to know. And you had told me before we started this webinar that really Social Security is interested in the year of paperwork prior to the application. So I can have all the other documentation on hand. I have years and years of boxes of paperwork, but really they're most interested in the last 12 months before.
Yes,
so,
absolutely. And a lot of it's because the definition is that the disabling condition is expected to last 12 months or longer, 12 months or longer, and or result in death. So that's kind of where that 12 months come into play. I mean, if you had a psych eval done 4 years ago and you're now applying if your adult child had a psych eval 4 years ago, now they're turning 18, you're going to want to get another psych eval done within those last 12 months or, leading up to that appointment with Social Security. So that way it's recent, fresh, valid data to show that even though there may not be a change in 4 years, it's still recent, valid data.
Good to know again. Okay, well, I am going to let you go. It's 1:05. I can't tell you how much we appreciate this. I do know that on February the 10th, you are doing a TEFRA Medicaid webinar for Family Connections. I had posted that out yesterday on our social media, but tell people just a real quick synopsis of what that's going to be.
Absolutely. So it's going to be a little bit more in-depth detail about what I briefly mentioned here, just kind of what the process looks like, what to expect. Also, we're going to talk a little bit more about work incentives because some of the parents, like they're wanting their teenager to go to work. The teenager wants to go to work. We're going to talk about some work incentives that also go along with not just TEFRA Medicaid, but SSI in general, and answer any other questions that parents might have going through appeals and denials, the application process, and so forth. So that's pretty much where we're going to be at with that.
Yeah, so that's familyconnections.org. You can go to their website. It's already listed up on there, or you can jump on our social media, our Facebook page, where this event's being live streamed. You can jump on there, and we had posted about that yesterday so that you can find those links. Anything else we need to know? You have another webinar that you do, I have heard, that's called Dispelling the Common Myths Amongst Benefits, the things you need to know. And I would like to schedule one of those with you, perhaps maybe for March. I think that would be a really good idea. We've gone through what we need to do and how we do it. And then I think that the questions that come up from this process would be really good to answer on the next one. So if you're up for that, that would be awesome.
I'd love to. And really with that, when we talk more in depth about working, the individuals are receiving disability benefits, but maybe they've been told, oh my gosh, if I go to work, my Medicaid's going to stop, or I'm going to lose all of my cash benefits, or I lost my check because of working wages and it's going to take me years to get it back. So we really dispel all those common myths with Social Security through that presentation. Also leading up to, if I start working, Social Security is going to find me no longer disabled. And that's why we find also a lot of times people are not wanting to go to work even during the application process with Social Security because they're afraid that oh my gosh, Social Security can say I can do some kind of work, so they're going to deny me. That's not true.
Right, I gotcha. Yeah, I think that will be really helpful. We'll let you get through the Family Connections training next month with the that's the first week of February, and then we'll have you come back to us in March and do that one for us. So thanks so much, Amber. I really appreciate it. We have the thank you from Nancy there as well. She said thank you. It's been very helpful. I hope it was. It was very helpful for me. I know what I need to do now. So thank you so much. I will talk to you soon. Thanks, Amber.
Thank you.
Take care.